0 to 1, meeting the cleaning, care and toilet requirements of children aged. Meeting the needs of children has an important place in taking a step forwards a healthy and happy life. Giving the child self-care without delay, lovingly and adequately ensures a secure attachment to his parents and his environment in his future life. It is known that babies whose needs are not met in this period create a negative perception that when they need their environment in the future, they will not come, and that nothing can be expected from anyone to get rid of the pain. Meeting the self-care skills of children aged 0 to 36 months should not be considered only as cleaning and nutrition. This period is also the period when the baby begins to communicate securely with his environment and the basic sense of trust is established for the first time. Body cleaning and its importance in 0 to 1 year old children. Cleanliness is one of the first conditions of protection from diseases. Cleaning affects not only physical health but also mental health. Children who grow up clean and well-groomed have a stronger immune system. Since children cannot do their own cleaning, parents should pay attention to the situation. Cleaning is carried out in general and regional way. General cleaning is washing the whole body, that is, taking a bath. It is important to have a regular bath for the child to gain the habit of cleaning. Thanks to the bath, the dirt on the skin is also cleaned. In addition, taking a bath increases the child's appetite, his sleep is regular, and his development is positively affected. The baby's first bath should be done after the navel falls and when the umbilical wound heals. Until this time, it is necessary to wipe the baby's body with a soapy, soft cloth without pressing it in order to protect the baby's body from diaper rash. The baby's skin should then be cleaned by rinsing only a soft cloth dampened with water. If wet wipes will be used for body cleaning, alcohol-free ones should be preferred. Since bathing can cause dryness on the baby's skin, it is sufficient to take a bath every other day, but this number may change according to the weather. During the winter, the baby's body should be wiped daily and bathed at least twice a week. The baby's bath time should not be too long. Care should be taken to clean the hair of babies. Hair should be washed and combed with a soft-tip brush in every bath to prevent host formation. Attention should be paid to the prenatal during scanning. After the bath, a suitable moisturizer can be applied to the baby's skin. Bathing should be done before feeding and sleep. Regional cleaning should be done in cases where children are not bathed in body cleaning. In regional cleaning, face, mouth, teeth, hands and feet are cleaned. Facial cleaning. Facial cleaning in babies should be done regularly with a soft, clean cloth. In eye cleaning, the burrs in the baby's eyes should be gently wiped without pressing from the inside out. It is important that the cloth used is clean, hygienic and disposable. There is no need to do anything in cleaning the nose unless the nose is blocked. If there is any visible nasal waste, it can be cleaned with a nasal cleaning stick or apparatus. Cleaning of the ears should be done by cleaning the outside and back of the ear without inserting anything into the ear. Mouth teeth cleaning. When babies' mouths are not cleaned after feeding, sores may occur in the mouth. Since these sores, called thrush, hurt the baby, the mouth should be cleaned with carbonated water after breastfeeding. When the baby's first teeth begin to emerge, the mouth should be wiped with a clean, wet gauze pad after breakfast and before going to bed. Toothbrush use should be started after the posterior teeth erupt. In this period, it is important to give the child the habit of brushing teeth. Hand cleaning. Since babies often bring their hands to their mouths, their hands must be constantly clean. This process should be done by opening the baby's hands and rinsing with a clean, soapy cloth between the fingers. When it is necessary to use wet wipes, alcohol-free wipes should be preferred. Care should be taken to take care of nails while cleaning hands. Nails should be trimmed at regular intervals. In the first months, it is easier to cut nails while babies are sleeping. Nails that soften after a bath are also easily cut. Fingernails should be cut in a half-moon shape. Foot cleaning. Babies' feet and between toes should be wiped with a clean cloth. Care should also be taken to take for the toenails. Toenails should be trimmed straight. Thus, the formation of sunken is also prevented. The baby should not be put on shoes in the first months. Shoes should be put on when he starts to take his steps. The importance of bottom cleaning and the steps of bottom cleaning. Newborn babies feed frequently during the day and go to the toilet shortly after feeding. It is important that babies' bottom cleaning is done on time as much as possible. Behavioral problems such as moodiness, insomnia, and diaper rash may occur in babies whose bottom cleaning is not done on time. Since baby's skin is sensitive, redness and irritation can hurt. Improper changing can cause urinary tract infection. For this reason, health compliance and care have an important place in changing diapers. Steps to follow when changing the baby's diaper. Before starting to change the baby's diaper, all materials, changing diapers, wet cotton or non-alcoholic wet wipes, anti-nappy cream are prepared in advance. First, the baby is placed on its back on the bottom opening cover. Meanwhile, talking and communicating with the baby will be beneficial for the baby's emotional development. Then the baby's diaper is opened. The baby is lifted by holding both feet by the ankles. The dirty cloth under it is pulled and put in a place where the baby's hand cannot touch. Bottom cleaning is done by gently wiping from front to back. While wiping, care should be taken to clean the curved areas. The last butt is cleaned. The used wet wipe is cleaned on the dirty cloth. The used wet wipe is placed on the dirty cloth. After wiping, the wiped area is allowed to dry by contacting the air before closing the cloth. Before tying the diaper, the ointment or cream recommended by the doctor for diaper rash is applied. Since the powder is in powder form, it should never be used as it can escape into the lungs. Then the front part of the diaper is pulled towards the baby's navel with both ends equal. The tapes are opened and closed by pulling towards the pasted area. The dirty cloth is lifted by wrapping the adhesive strips around it. Changing diapers is completed by the mother washing her own hands. 0 to 1 Physical gymnastics for 8 children. Body gymnastics is the movements performed in accordance with the development of babies. Babies experience psychological and physical relief thanks to gymnastics. With the movements, babies are supported to be flexible, to have a healthy posture, and to have healthy muscle structures in later ages. In addition, the baby's communication with the mother or father during gymnastics positively affects his emotional development. While the baby will have a strong body in the future with gymnastics, it is also ensured that the baby loves sports. While the baby's immune system develops with body gymnastics, the digestive system also relaxes. In the 0 to 1 age range, gymnastics should be started with the baby's gaining head control. If the baby moves too much after eating, it can cause vomiting. For this reason, the times before the meal should be preferred to make the baby do physical gymnastics. In addition, the baby's transition to sleep after the bath after the movement becomes easier. The baby should not be forced to do the movements. Before starting gymnastics, care should be taken to ensure that the room temperature is ideal 22 degrees Celsius on average. A clean cloth should be laid on a flat surface and the baby should be dressed in comfortable clothes. Movements should be started without tiring and forcing the baby. If she does not want to have a baby during the movement, she should not be insisted. The person doing the gymnastics should be in happy communication with the baby by making eye contact. The duration of gymnastics can be between 3 to 5 minutes. The number of moves starts with 1 and gradually increases. Over time, the number of repetitions can be increased to 10. 0 to 1 gymnastic movements suitable for 8 children. The baby is placed on his back. Grasping the hands, the arms are slowly raised up. Then it is lowered. Then the right arm and left arm are also raised and lowered separately. This movement is an effective movement in the development of arm muscles. While the baby is lying on his back, the arms are open to the side and then closed across the chest. After repeating the same movement a few times, the arms are opened and closed one by one. The baby is lifted up slowly by holding the arms from the lying position. When it reaches the semi-sitting position, it is lowered again. In order to make this move, it is important that the baby has head control. It is an effective movement to strengthen the baby's arm, shoulder, and back muscles. While the baby is lying on his back, his legs are held and the legs are bent at the knee and moved back and forth. This pushing and pulling motion is repeated several times. Then the baby's right and left legs are moved back and forth one by one as if riding a bicycle. This move strengthens baby's hip, leg, knee and abdominal muscles. It also relieves babies with gas pains. By holding the baby by the ankles, the baby's legs are lifted up and down. After the 6th month, it can be held by the feet and lifted into the air and hung upside down. This move helps baby build stamina. Trying to bring the baby's elbow and knee closer together. The same movement is repeated for the right and left. This movement helps the baby gain flexibility.